Well, hello there, future nurses. It's so good to be back. I am so happy to be here, and I'm happy to be doing this teaching for you today. Um, I know we're getting ready to start the new semester. Some people have already started. My school went back today. Then there's some people that are going to be going back next week and at the end of the month, and then some students aren't starting until September. But I thought I'd start this right now, get this out there so you have time to practice, time to review it, time to download the uh, the uh, the resource guide that I created. And if you can't catch this live, it's going to be on the page for replay, so don't worry about it. So just a few things I want to take care of, and let's see. I want to do a little bit of hi Wendy. Oh my gosh, hi. Um you're so cute, honey. So I want to do a little bit of housekeeping before we get started. So I want to let you know about a couple things. So every Monday, which is today, I put out a new video, and it's part of a series that I call Med Monday. And I do just a short, under 5 minutes. Sometimes it's a smidge over. I think next week's might be just a little bit over because there's a lot of information. But for the most part, they're about 5 minutes or less, just a quick run over or run through of a medication, one medication. And at the end of the teaching, there is a challenge question. If you answer the challenge question, at the next week, we will be doing a drawing for a $25 Amazon gift card. So we've already had a couple winners, and I know that Wendy was a winner last week, and I can't remember the other person's name that won the week before. So that's lots of fun. It keeps you practicing your dosage calculation all year long. I'm trying to make them hard, but you guys are getting them all right. So I don't know if they're not hard enough or you guys are just that awesome. So I want to let you know, if you go to NursingSchoolSimplified.com/MedMonday, I will send you the med sheet every week and the video for you to watch. And you can keep those as resources. They're great, especially when you have to do med cards. The information's all right there for you to use. So would take care of that. So next thing, I wanted to let you know that I started a podcast, and I'm on week 4 now. The next episode will be live Wednesday. So there's already 3 episodes up. You can listen to the podcast on Apple Podcasts. I keep wanting to say iTunes, Apple Podcasts, Spotify, and iHeartRadio for right now. And I think I saw somebody watch or listen to it on Google something. And I don't remember putting it on there, but when I upload it, it does its own thing. And I'm just happy it gets out. So I'm not that technical. But if you need me to operate some technical equipment to save my patient, I can do that. So I just want to let you know, so you can go ahead and listen. And I usually put a little post up every week so you can listen on Facebook too. And I do have it on YouTube. I'm putting them up on YouTube, just the audio. I will be doing, let me go back to the Med Mondays, because the Med Mondays, I'm actually going to be changing up the video a little bit, and they will be on YouTube as well. Next thing I want to talk about is our Facebook group. So if you're watching this from the Facebook page, I'm streaming in 2 places right now. I'm in the group and on the page. If you're watching on the page, go ahead, if you want to, join the group. We have a great group. It's growing every day. I can't believe how fast it's growing. And I'm going to be doing some special teaching in the group only. So you won't be able to get that content on the page. It'll only be exclusive in the group. So if you want to join the group, there's 3 questions to answer. And I think one is like, okay. And then the other one is, what semester are you in? And I think the third one is, what do you have, like, what's your biggest challenge in nursing school? So do that. If you have any questions, comments, concerns, you need help with something, anything, you can always direct message me, or you can email me at Cynthia@NursingSchoolSimplified.com, and I promise to get back to you. So today we're going to be talking about med-surg and how to succeed in med-surg, and actually how to study for med-surg. And if you look at the bottom of the screen, there's a link there. If you go to nursingSchoolSimplified.com/med-surg simplified guide, and I think I'm going to shorten that a little bit, but for right now it's med-surg simplified guide. I'll send you a resource guide of what we're going over today so that you have it as a resource. In addition to that, I've done a little one for you. I did cardio. Which one did I do? I did cardiovascular disease, and I did the whole thing for you. So it's there. There's a diagram where you can trace the blood flow through the heart for the anatomy. There's some stuff on there about EKG for the physiology that goes under physiology, but it's electrophysiology. So I did one for you, and it's all there. So you can see how it's done. So if you haven't already gotten that, just go to that link. You don't need to do it right now, but I will send that to you, and you can keep it as a resource. So one last thing, just if you could click like, click share, so we can get more people here, more students, because the more students I help, the better. And it warms my heart. I love helping students. So we're going to go ahead and get started. There are 11 steps, and I know it sounds like a lot, but I didn't want to combine things because I didn't want things to get left out. But you can combine step 1 and step 2. So this is what I teach my students at the beginning of every semester, whether they're in first semester, second semester, or fourth semester. I teach them this step-by-step way to study. This is how I learned to study. I failed my first test in nursing school and cried, and I'm not even a crier, and cried and thought, I'm never going to make it. I'm going to end up being a stripper. All the things that go through your head, right? And when I failed my first test, I didn't want to fail a second one, and I didn't know what to do. And this was back in the day when Google, it was a thing, but it wasn't what it is today. Like, there was barely anything on Google, barely anything. I don't even think you could really shop on Google. And I don't even know what we did on the internet back then, because there really wasn't a lot going on. And it was a lot of scholarly stuff, but there weren't resources like there are today. So I didn't know what to do, and none of us knew what to do, because they basically just threw us out there and expected us to learn it ourselves. I'm sure you're familiar with that, right? So I went back, I sat down, and I started looking at my book. And if you look at your text, you'll see that each section, when we're talking about a system, let's say cardiovascular system is broken down into sections. So your first part of that system is going to be your anatomy and your physiology review. Then you're going to have pathophysiology. And then depending how your book does it, the rest of the information will flow pretty much like I'm going to show you today. Now, my school right now is using 2 texts for the med-surg course. And I think the reason is because they're phasing one of them out, but I don't know which one, but I have access to both texts. And when I went through them, they're set up just the same. And I have some old volumes that I keep on hand because I don't like reading stuff online. And they're all laid out the same. So we're going to follow that format. And if you follow this format, you are not going to have to read everything. Because I had a student, this was a couple semesters ago, when I asked everyone, who reads all this, right? Because their test was going to be like on 12 chapters. And I'm like, who has time to read all this? And one of the girls raised her hand, Erica Espinoza, if you're watching. She raises her hand. She says, I read it. And I'm like, what do you mean you read it? She says, I read everything. I'm like, well, how long does that take you? She said 40 hours. I'm like, what? That's a full-time job, 40 hours. Who's got time for that? I feel like that meme, that lady, ain't nobody got time for that, right? 40 hours on top of school, on top of work, on top of clinicals, on top of family. I don't know how she did it. So that's when I started teaching this step-by-step process, because I was like, honey, don't do that. What you're going to find in your text is that if you start really looking at it, most of the information you need is in boxes and graphs, and you're not going to have to read everything word for word. So that's where we're going to pull our information from. And that's how you're going to do this every single time. Now, I'm not going to lie. This is not something that's, really quick and you're going to be able to finish in an hour. Maybe you can. Maybe you're a whiz and you can finish in an hour. I can't. Even when I do these guides for my students, like the one I did for you guys, it took me more than an hour, because first of all, I know this information, but I wanted to make sure that I had everything, that I didn't miss anything, that I didn't skip something. And so it did take me longer than an hour. So if it takes me longer than an hour, I can only assume it's going to take you longer than an hour. So let me just get to my notes here so I stay on track. So we're going to start with step 1 and step 2. So anatomy and physiology, you should already have taken this course. Now, I know some schools, and off the top of my head, I can't think of which ones, but I have seen where they incorporate anatomy and physiology into the program. So you're taking anatomy and physiology with nursing courses. And I honestly don't know how students do that, because that's a lot of information. But for most of you, anatomy and physiology should be a review. You should already know this. And take your time with this if you need a good review, but try not to spend too much of your time on this, okay? So with the anatomy and physiology, what I recommend and what I still do, especially when I'm teaching students or when I'm teaching family members or patients about something, I draw it out and I label it, because it's easier for me to remember that way. My brain that's how my brain works. Some people, like my sister, can read something once and extrapolate 50 things out of that. Not me. I've got to read it over and over. I have to draw it. I have to label it. Now, don't get all, Van Gogh over here. This doesn't have to be perfect. This doesn't have to be artistic. All it has to be is simple and easy. You don't even have to use like colored pens or pencils, but if you want to, you can, but don't spend too much time on this. When you're in school, time is a commodity that you have very little of, and you have to control as much of it as you can. So don't waste it on little things like this. So I recommend drawing out whatever it is you're studying. So let's say it's cardiovascular, or let's say it's pulmonary. You're going to draw the lungs, or you'll draw the heart. You'll label all the structures. And you can, I think in the guide that I provided you, there's a blank copy that you can make copies of, and then just practice filling it in until you get faster and faster and you don't forget something. Next, you're going to do your physiology. Now, there's 2 ways that you can do this. And for me, what's simple and easy and quick and to the point, because that's how I am, are bullet points. And I just list, this happens, this happens, this happens, this happens. You just boom, 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 boom. Some people need to see it, more like, in a picture. So you can do the concept mapping. Some people call it mind mapping. You can do that, whatever works for you, but make sure that you're understanding the physiology, because I will tell you this, that even as much experience as I have, I've been a nurse for almost 14 years now. I've worked ER, critical care, recovery. I've done open heart patients. I've done trauma patients. Like, I've seen and I've done a lot of things, but there are things that I come across that I've never seen before, or I've never taken care of a patient with this condition. And as long as I can fall back on my anatomy and my physiology, I can figure things out. It'll make it so much easier for you. So get in this habit of just doing a quick review. Like I said, you can do bullet points or you can do your concept mapping. Now, I will tell you that what I also do is I like to keep things in order. I'm a numbers girl. I'm a list kind of person, and I always start neuro and work my way down. Neuro, what happens physiologically with this patient neuro-wise? What happens physiologically with this patient cardiovascularly? So that I can keep it. This is even how I take report. This is how I give report. I do neuro, cardiovascular, pulmonary, GI, GU, integumentary, musculoskeletal. And then if there's like hematology or oncology or endocrine, we throw that in at the end. But get in that habit of system by system in the same order every time. It'll save you a lot of time, and it'll help you process information a lot more quickly. Okay, so next we're going to go to pathophysiology. Now, I don't always do this and I don't always recommend, but for pathophysiology, I would suggest Googling it. And why? Because your book is going to have maybe a paragraph, 2 paragraphs, sometimes 3 paragraphs, and they don't get very deep into the pathophysiology. I've even seen some pathophysiology books that basically give a definition. I spent a lot of money on this one patho book, and basically it's a 1-page with a picture and a basic definition of what the condition is, but it doesn't give the pathophysiologic process, and it's more complicated than just 5 lines. So I do Google. I recommend Googling. Look for scholarly papers, look for PDFs. Wiki sometimes has some good patho on there, but I find that it's much better as a resource than your book because it gives much more detail. And the deeper you can get into the pathophysiology, the better you're going to understand what's happening with your patient, the more on top of your patient you'll be as far as staying ahead of signs and symptoms, and you'll be able to care for them. And when it comes down to a test, you're going to be able to answer the questions, because if you haven't taken a med-surg test yet, what you're going to find is that they're going to describe something. They're going to give you the signs and symptoms. They're going to describe the pathophysiology. And then you're going to have to figure out what that is and answer accordingly. So knowing your patho, and honestly, knowing my patho has saved me and saved my patients more times than I can count. Because when I can't figure out what's happening with my patient, I go right back to my basics, and I go to my anatomy, my physiology, and my patho, and I can figure it out every single time. Here's an example. So I had a patient that had transverse myelitis, and I had never come across that condition before. And she was pretty sick. So I literally Googled it, read as fast as I could what the deal was with transverse myelitis. And because I knew anatomy and physiology, and I read that pathophysiology real quick, I knew exactly what was going to happen to this patient, and I was able to stay ahead of it. It's a great resource. So I know a lot of instructors. I know a lot of instructors that'll just tell you, Google it. And so I'm going to tell you, Google it, because even my kid tells me, Google it when I have to figure something out. It's a great resource, much better than your patho books. When you're doing your patho, again, you can do a list form, bullet points, or you can do the concept mapping. What I also suggest with your patho is that if you choose to do the list form and you write out this happens, then that happens, then this happens, and you also keep it within the neuro, cardiovascular, pulmonary, GI, GU, right? Try, after you write it all out get a blank piece of paper, and without looking at what you just wrote, try to write down as much as you can remember. And do this as a practice until you remember everything and you can write it down from memory. It takes practice to do it, but once you start getting good at it, you can just whip that out really quick. And it's good. It's a good development for your brain, really, to process information quickly. If you like the concept mapping, I know a lot of people like the concept mapping. For me, it seems too busy. It's just too much all over. I like very linear. So that's how I suggest one of those two ways. So next, you need to know your signs and symptoms for whatever it is you're studying. So let's say that we're studying liver failure. And I'm going to tell you that and I remember this, on my NCLEX, one of my questions was about Lennox cirrhosis. And I had no clue what Lennox cirrhosis was. I literally started crying right there at the testing center because I thought, oh my God, this is why I'm going to fail, because I don't know anything. And I thought, well, there's really only one thing that gets cirrhotic. It must be some kind of liver cirrhosis. Little did I know that that's what cirrhosis is really called, Lennox cirrhosis. So let's say your patient has liver cirrhosis and they're getting towards end-stage liver disease. Let's go ahead and we're going to list our signs and symptoms by system. So start with neuro. Neurologically, what happens to patients with end-stage liver disease? Think about it. Does anybody want to try and answer? I know there's a little delay, but I want you to think about this. And while you're writing this out, I want you to keep asking yourself, you should always ask yourself, why? Why is this happening? Why? Why? What do I do next? What's going to happen? Constantly be questioning everything. So if your patient has end-stage liver disease and we need to know our signs and symptoms, let's start neurologically. Neurologically, with end-stage liver disease, typically they have altered level of consciousness. And why is that? Because they have elevated ammonia levels. They could be confused. They might be obtunded. It just depends on the level of disease that they're experiencing or how progressed the disease is. Cardiovascularly, if they're in liver failure, they may have decreased cardiac output because most of the time with liver failure, we end up developing what we call a cardiohepatic and renal syndrome, where because the liver is failing, it causes kidney failure and causes heart failure. But you can also get liver failure from heart failure. Sounds fun, doesn't it? Once you start learning all this and you get patients with complicated, complex issues, it's fun. It's fun to figure it out. It's fun to take care of these patients. It's fun. The biggest thing for me is if I have a patient that is in like acute renal injury, acute kidney injury, and they're not making urine, and I work my whole shift and they start making urine and it's pretty and it's clear and it's yellow, I'm the happiest person ever. I'm a simple girl. I like when my patients pee. When I see that urine go through the Foley, I'm a happy girl. So if you try to think of this like a game and make it sound exciting instead of like, oh my God, I have to learn all this, it will be exciting. So let's get back. So cardiovascularly, we might have some decreased cardiac output. We might have some additional heart failure because of the liver. Pulmonary wise, if we're having some backup of volume, it could go into the lungs and we could be pulmonarily congested, so we could have fluid in our lungs. They could also have problems with breathing because as the liver gets diseased, it gets bigger. And I encourage you to go look on the internet, Google what it looks like, see what a normal liver size is compared to a diseased liver, and it gets huge. And so when you have that big liver pressing on the diaphragm, they can't breathe. So they're breathing a little more shallow, right? GI, they could have nausea, they could have vomiting, they could have decreased appetite because with an enlarged liver, it's pressing on that stomach and they just can't eat as much. They may have changes in their stool color or pattern. For GU, for renal, urine is probably going to be decreased and darker. Oh, on the abdomen, on GI, their abdomen will be distended, and usually we get a fluid shift. And so you can actually, when you percuss, you'll see the wave of fluid under the skin, and that's how you know they have fluid under their skin. It's versus air, right? Because it'll sound tympanic when you percuss, but if you percuss, it'll ripple across the stomach, and that's how you know there's fluid. So the next time you get a liver failure patient, especially if they're advanced liver failure, I want you to try that when you're doing your assessment. Your instructor will be impressed. Okay. So GU, we talked about the urine, and integumentary, their skin gets dry and itchy, and it could get jaundiced, and they could be bruising. And why are they bruising? Why? Because their liver's failing, and they have no clotting factors. And so every time they bang on something, they bruise. Hematologically, they'll bleed because, again, we have no clotting factors. So you see, if you list your signs and symptoms by system, it makes it way easier to remember them, because you're going to have, and I remember this clearly, when I was in nursing school, having tests, having exams where it would give you the signs and symptoms of something. And the expectation was you knew what that disease process was, and you were able to answer the question appropriately. So learn your signs and symptoms. Next is our assessment. So remember, we have two assessments when we assess our patients. We have our subjective and we have objective. When you're doing your objective assessment, that includes your physical assessment on your patient. Again, you're going to go system by system. Neuro, cardiovascular, pulmonary, GI, GU, integumentary, musculoskeletal, hematologic, and endocrine. That order every single time. What are you going to be assessing neurologically in your patient with liver failure? You're going to be assessing mental status, right? And why? And you need to be asking yourself the rationale for why we're going to be assessing mental status. What else are we going to assess? We can assess pupils. We want to look at their eyes because their eyes might be yellow, jaundice, right? Or ictus. That's another word. I like that word. So always go system by system when you're performing your assessment. Next, we get to our nursing diagnosis and interventions. And you're going to find that right in your book. And it's going to say nursing diagnosis. Use those. Write that down. Nursing interventions, anything that is nursing driven. So let's say we have a patient with heart failure and they have bilateral lower edema, pitting edema, right? So what can we do to make that better? We can elevate their lower extremities, right? That's nursing driven. We don't need a physician to tell us to do that. So try to get as many nursing driven interventions in there as you can while you're thinking about the rationale. You don't have to write the rationale. If it helps you to remember, go ahead, but you'll get questions on your exam that explain a disease process, tell you what the intervention is, and then expect you to understand the rationale for that intervention. I also suggest getting this book. Can you see that? This is by far the best care plan book I have ever seen. Ever seen. My students use this. This has everything in it. The only thing that could make this better is when they put the interventions, if they would section them out into labs and physical assessment and nursing interventions and just section them out. They really don't do that. And so when you're reading through the interventions, it's a little scattered, and that I don't like, but that's just because my mind is very linear and I think very linearly. I can't even say that word. So this is a great book. One of my colleagues at work, she actually reviewed the questions in this. I love this book. I love this book. The publisher sent it to me and it was like Christmas. What a dork. Next, medications. And this will be in a graph. This should be in some kind of graph or box. And they'll list classifications and then give examples of the medications under there. So I would use this time when you're including the medications to fill out your drug cards, even if you don't need them for clinicals. Like my 4th semesters, they don't need drug cards. I still make them do drug cards because I think it's a great refresher, but if they've already got them made, they can use them and just use them as a reference, because I don't want people to be nervous when they're passing meds. You're already nervous enough. And any clue you could have and cues that you can use, I'm not opposed to it. And there are medications I don't know, and I have to look them up right there. So there's no shame in that. But I would use this time right now to make your drug cards so that you have them as a reference, so that when you see that medication again on another disease process, you've already got it done. And especially if you're looking at if you're working on a system, say cardiovascular, diuretic, most of them you're going to be giving diuretics, right? So you won't have to do them more than once and you'll already have it done. So I would use this time. Also, don't forget Med Monday, because I have those sheets. I call them Med Fun sheets. I don't know how fun they are. They're not fun for me to make, but I do it anyway. But you can use those as a resource, and all the information's right there for you to do your drug cards. And I don't have it up on the website right now because we're building that page out, but they'll be archived on there, and you can still get them off of Facebook. They'll be on there. And I think some are even on YouTube, because I think my assistant was putting them on YouTube. When you're, okay, on the medications though, let's say you're learning endocrine and you're learning about diabetes. You're going to want to know, especially for insulins, there are specific medications you're going to want to know peak. You're going to want to know onset. Insulin is the one I can think of. I know vancomycin, you are going to want to draw labs for a peak and a trough. So there's little tiny specific things, but for the most part, you're not going to need to know onset unless it's something that could be potentially life-threatening, like insulin. And so cue into that when you're doing your medications. Number 8 is patient teaching, and patient and family teaching, because sometimes maybe your patient can't learn. Maybe they're intubated. Maybe they are children and you can't teach them all the ins and outs of the disease process. But when we're teaching our patients and our families, we start just the way we're doing our study right now for MedSurg. We teach them about the pathophysiology, about the disease process, signs and symptoms that they should be looking for. Teach them about the medications that they'll be taking. Teach them about calling their physician, if they experience certain signs and symptoms. You get the idea. We're teaching, and you can teach them about everything you're doing. From the moment you walk in the room, you're teaching your patient. You're teaching them about the unit layout, the unit schedule. Most people are concerned when lunch is coming. So, lunch comes between 2 and 3. That's teaching. You're teaching them about medications when you're giving the medication. You're teaching about lab draws, what lab you're drawing, why you're drawing that lab. You're teaching about why we're elevating lower extremities. We're teaching about safety. We're constantly teaching. So include as much as you can. Usually that is in some kind of little graph again. But you can also use your book. Next, we're going to do labs. Now, I don't know, like my students aren't required to get a lab, like, what do they call it? It's like a lab and diagnostic book. I was when I was a student, and it was the best thing ever. If you don't have a book, you can go to, I think it's onlinelabs.org, and they have all the information on there. What you really want to be aware of, and a lot of this, like your labs, if you do your labs on a sheet, you only have to do it once because you can use that same form for other disease processes. So let's say a CBC, which is a complete blood count. In our liver failure patient, why do we want a CBC? Because they could potentially be bleeding. So we want to look at that hemoglobin and hematocrit because we want to see if their blood levels have dropped. We also want to look at the platelets on there because platelets, if they're low, could indicate that our patient could have a bleeding problem. We want to look at the white blood cell count because it could indicate that our patient has an infection, or it could mean that our patient might be neutropenic if it's very low, that they've used up all their white blood cells. So the most common labs that you're going to see are CBC, chemistry panels, specific, like for cardiovascular, you might see troponin or thyroid. But once you do most of these, you don't have to do them again because you can just recycle them through the semester. And number 10 is exams. So what kind of exams are we going to be performing on this patient? Are they going to have an EKG? Are they going to have an X-ray? Do they need to have a CT? Do they need an MRI? Do they need an ultrasound? It just depends on the condition. So, and usually that is in a box too. And then number 11, our very, very last one, is procedures. So specific to that condition, let's say our patient has esophageal varices. They may have to have an endoscopy, right? They may have to have banding. So those will be in a box too. And all you need to do is go find those procedures and write them down. And make sure, especially with the procedures, you want to know what kind of assessment you're going to perform before, during, and after the procedure. You'll also want to know patient teaching and any complications that can result from the procedure. And that's it. Number 11. So let me go over here and see if anybody has any questions. I don't see any questions. Somebody says, thank you for Med Monday. So, you know what I forgot to tell you? If you're in the group on this application where I'm streaming, you have to I'll set up the process in there. You just basically have to say it's okay to use your name because the group is private. It hides your name. And so it just says Facebook user. So I don't know who you are, Facebook user, but it says, thank you for the Med Mondays. So, and I really appreciate that. So that's it. That's it. 11 easy steps. Don't forget to go and get the guide, right, at NursingSchoolSimplified.com/MedSurg Simplified Guide. Don't forget we have Med Mondays. You can sign up for that, and I'll send you those. Don't forget about the podcast. If you're on the Facebook page and you want to get on our group, just request to get in. And what else? Next week, I'm going to be doing a diabetic teaching for patients. So I'm going to cover everything you need to teach your diabetic patients. So when you are out on the floor and you're in clinical, you can impress the socks off your instructor because you're going to know everything you need to teach your patient. And I think that's it. New podcast comes out on Wednesday. And if you guys haven't started school yet, I suggest you start getting everything ready and maybe make sure you have a little bit of self-care time. And if you have started school, yay, you're going to be one more semester closer to finishing. And I hope you guys have a great rest of your afternoon or evening, depending where you are. And thank you so much for watching, and I will talk with you next time.